Sunday is World Bipolar Day. It's a day set aside to raise awareness and reduce the stigma associated with a mental illness. It is observed on March 30th every year. It's on the birthday of painter Vincent van Gogh. His creativity was paralleled with his mental illness, and he was posthumously diagnosed with bipolar disorder. Now, to help us understand more about the disorder, we welcome the first at four, Dr. David Medina with Nova Psychiatry, that is. Thanks so much for joining us, Dr. Medina.
Hi, how are you?
Doing very well today. First, we'd like to know exactly what is bipolar disorder, BD1 and BD2.
So bipolar disorder is a psychiatric illness. It used to be called manic depression. The name was changed to bipolar. And bipolar implies that there's like two extremes of the moods. So people with bipolar tend to become extremely high in terms of energy and mood grandiosity and so forth, or they can get too depressed, like severely depressed. They can have both extremes of the spectrum of the mood. Bipolar 1 and 2, they're very similar in terms of that. Only the difference is when they're manic, when they're high, the highs are shorter and less intensive less intense in bipolar 2 as opposed to bipolar 1.
Now, Dr. Medina, it is believed that around 6 million adults are living with the disorder. Who's most at risk of developing bipolar disorder, and is it hereditary?
So bipolar is a challenge. It's a challenging diagnosis and a challenging condition that requires specialized treatment and diagnosis. So the patients that suffer from bipolar, they have to overcome many barriers, and one of them is the stigma, of course, stigma in society, stigma in the medical system. But there are treatments, and there are possibilities of recovery, and a lot of people do well with the condition.
And before we get to the treatments for people who are suffering with bipolar disorder, describe for us, Dr. Medina, what life is like for people who have bipolar disorder.
Bipolar disorder is a condition that requires medication management by, as I say, by a psychiatrist that is specialized in that disorder. The medications that we're talking about we call it mood stabilizers. The quintessential mood stabilizer is lithium. There are antipsychotics that they can also use for other conditions like schizophrenia, but they are also mood stabilizers. And there are other tools to treat other symptoms associated to bipolar, but these are the main ones.
And how do we as a society help to reduce the stigma around this illness and other mental illness disorders?
Well, an initiative like the World Bipolar, they are created for that, to basically educate and spread the word, kind of in a sense that bipolar is real, bipolar is disabling, and bipolar at the same time can be treated and must be treated with evidence-based treatments, scientific-based, but also with care and compassion. And we got to understand that we have to be caring and compassion to the patients that have bipolar.
Dr. Medina, thanks so much for being our guest here today on First at 4. We appreciate the information that you've shared with us today about bipolar disorder. Thanks so much.
Thank you.